It's time to get the story behind the story. Interviews with newsmakers, news breakers, and Vermonters making a difference. WCAX presents 802 News with Mark Johnson. Here's Mark.
Approximately 172,000 Vermonters are on Medicaid. The latest figures peg the costs at about $2.2 billion a year. To put that in perspective, Medicaid accounts for more than 1 out of every $4 in the Vermont state budget. The federal government covers more than half of that cost, so when the U.S. Congress considers cuts to Medicaid, as it's currently doing, in part to help finance tax cuts, that will likely have big implications here in Vermont, not only on patients themselves, but on the hospitals, physician practices, and nursing homes that have significant numbers of Medicaid clients. In this edition of 802 News, sponsored by Red Hen Baking Company, I spoke with DaShawn Groves, the Commissioner of the Department of Vermont Health Access, about what the impacts of cuts to Medicaid might be. Right now, he says, there's a lot of uncertainty, but he acknowledges officials are worried. First, a word from our sponsor. At Red Hen Baking Company, they believe pure, uncomplicated ingredients in the hands of skilled artisans are the building blocks for great food. They're dedicated to creating the best food from the best ingredients. You'll find an ever-changing lineup of delicious pastries, sandwiches, and soups at their beautiful cafe off Route 2 in Middlesex, just off I-89. Their breads are also available in many other locations. Led by owners Randy George and Eliza Kane, Red Hen Baking Company has been on the leading edge of the local food movement since 1999. The reason I wanted to talk to you is the Medicaid program is a huge program in Vermont. How much is spent in Vermont on Medicaid services?
About $2.2 billion currently from this past year is what our Medicaid budget is.
How much of that comes from the federal government? How much comes from state?
Yeah, and about 57% of that comes from the federal government, and the rest comes from the state. So it's a large portion of our budget is matched by the feds.
What are you hearing? How concerned are you that there are going to be cuts?
I mean, what we're hearing right now is you have two bills in Congress that look at Medicaid differently. One's looking at a $180 billion cut for budget reconciliation. The other one's $1 billion. There's still going to be cuts to the program. What that looks like and how big of those cuts, that's the uncertainty that we're facing here.
How do you operate in a world of uncertainty?
You know, Mark, it's very difficult. And it's always looking at going back and thinking about what do we know and what are these impacts on Vermonters, right? If we're looking at cuts, we're looking at provider rates, we're looking at eligibility groups, we're looking at services. And those are the three things that we can cut in order to meet those requirements from the feds.
So how do you approach that, knowing that those are the directions, really the only choices you have?
Yeah, I mean, I think it depends on what Congress and the administration are looking at, right? So there are things about looking at the childless adults expansion group. If they take that enhanced federal match away, you're looking at about an $80 million cut to the Vermont Medicaid program. If you're looking at provider taxes and how we fund some of our programs, if they eliminate that possibility, that's a $252 million per year cut that we're looking at. So these are big cuts to the program, and it's going to be up to us to kind of figure out where do we make those cuts and how do we do it in a way that it doesn't invoke harm to those people, knowing that access, and no matter what we do, access, whether it's coverage or to services, is going to be impacted.
Who is the most likely group to be impacted the most?
I would say everyone who's on Medicaid. The way that what Congress is looking at is just the financing of Medicaid, right? Deep down, we have to look at the eligibility groups, the providers, and looking at what's mandatory and statute, what are optionals, and coming up with a list and saying, here are the things that we can continue to cover, here are the things that we have to cover, and moving things forward. It's not an easy process. It's never going to be an easy process in this.
What's mandatory and what's optional?
Yeah, so if you look at it, CMS has the Center for Medicaid and Medicare and Medicare Services, the agency that oversees Medicaid on the federal level, has a kind of mandatory list. So like hospital coverage, provider coverage. Optional things are like dental. And so those are the things that impact everyone's health, right? So even if it's optional. And so it's going to be very hard to kind of tease through and keep the mandatory things and also continue to say, what is these optional things that we need that will continue to improve Vermonters' health and well-being?
Okay, I asked you this before, and I just need you to explain it a little bit better to me. I mean, it seems like right now, today, we're mid-March-ish. You're kind of operating in this world of unknown. You pick up the paper every day. You're not really sure what you're going to read. So how do you, when you come into work every day, how do you plan ahead for this, knowing that there needs to be lead time for all of this?
Yeah, and what we're looking at are cuts that we don't know when these cuts are going to, the cuts are going to happen at least in the federal fiscal year 26. But the way that they're constructing these budget saving numbers, right, is a 10-year process. So we don't know until we actually see that language when are things going to start to hit us. It could be in year one that they pass the bill, or it could be in another kind of long-term 5 years out or 8, depending on what number they're looking to cut from us. And so it's really unpredictable right now of not knowing, not seeing bill language, not knowing where either party or where the Republican Party on the Hill is of what they're thinking of cutting, or when do they expect those cuts and how deep those cuts are.
So do you plan that the cuts will happen in year one? Is that the only responsible way you can do it?
I mean, right now, what we're looking at is what has been proposed and what is that budget impact to Vermont. And that's all we can do right now because we just don't know.
There's so many different areas that Medicaid seems to be involved in. You mentioned hospital coverage. Vermont's hospitals are really in a lot of trouble. So what would be the impact of these cuts to hospitals? I mean, I think UVM is probably the exception to the rule here. They seem to be doing better than other places. But what would the impact, in your view, be to the smaller Vermont hospitals that are already struggling before this discussion even started?
Yeah, I mean, it's not just the hospitals. It's the federally qualified health centers. It's the smaller primary care practices. It's the dental offices, right? These are all going to be impacted by these cuts. And I mean, what we have heard or what we have seen in states who have not expanded Medicaid, right? Rural hospitals close because of that, because they're no longer getting Medicaid funding. Medicaid is a big payer in some of these entities. And so cutting that means you're cutting their financial sustainability as well.
Are you getting any feedback from them? Are they calling you and saying, DaShawn, what's coming up?
Yeah, I mean, we have the Medicaid and Exchange Advisory Committee that is currently enrolled, and so we give them a federal update of what we're hearing. They report back of what they're hearing. We have kind of one-on-one meetings with them as well of what's the information. It's about whoever has that information and sharing it and thinking about what does it mean up for Vermont.
Was your job totally different a year ago?
I just got here 6 months ago. So,
okay.
so yes.
Welcome to Vermont.
But I would say before the election, I think it was a little bit different of where we were thinking about doing with the Medicaid program and kind of bracing ourselves for the uncertainty now.
Where were you before?
I was actually in the Department of Healthcare Finance, which is the state Medicaid agency for the District of Columbia. And I spent about 8 years there. Also interesting, when I first began there, I also began at the first Trump administration. So very similar process of we don't know. There's this uncertainty of beginning. And what you thought you were going to do doesn't kind of pan out. And now we're faced with these larger kind of budget cuts and uncertainties of what is it that we're going to actually be able to do.
Refresh my memory. Was there any discussion about Medicaid cuts back in 2016, 2017?
Yeah, I mean, that first Trump administration was the repealing of the Affordable Care Act. And so Medicaid, the exchanges were all at risk of going away, or changes to Medicaid were going away, especially the expansion program or population.
You know, we talked a little bit about the rural hospitals, but the other area that I think of are nursing homes, long-term care. Same thing?
Yeah, absolutely. Any provider who takes Medicaid and is one of their largest payers, or one of the plurality of their payer mix, right, is at risk of losing more money with these budget cuts. So, we don't know what it looks like, but we do know that it's going to hit. And the thing is we're going to have to look at what are the things that we need to be doing to ensure sustainability, to ensuring that we still have providers participating in the Medicaid program and protecting those things. And it's going to be difficult.
Is there discussion about, because it is a shared program, is there discussion about Vermont trying to fill some of that gap?
I think what you're looking at, right? Like, even if we're looking at the expansion population, that's $80 million that Vermont would have to come up with. You're looking at provider taxes, that's $252 million. And so if you look at all those things together, or like an aggregate of everything that they have proposed, you're looking at a $550 million cut to the program. And so backfill, it's just not possible to backfill the entire cut based on that.
What I don't understand is how do you inform people? How do you plan for this? Do you war game this with a 30% cut, an 80% cut, and then sort of see from there? I mean, I've never worked in a bureaucracy.
Yeah, I mean, so right now there's a group of us who gets together every week in terms of the agencies, so the different departments that have a Medicaid population, that serve a Medicaid population. And we go through what is it being done, and then looking at those proposals and saying, here's what that impact could be, or here's what we're thinking that could be, right? So one of the things are like per capita caps. So that's where the feds will cap your program based on your historic spending. Well, that's hard to do and adjust for in the future. So the states are at risk there. So we really don't know. Like, we can come up with, here's the impact. But if something comes up in year 2 or 3 of being implemented, it's on us. It's hard because there's just a lot of uncertainty here that we just, I hate to like be a parrot and say there's a lot of uncertainty, but it is. And it's very scary that there is, because it's hard to plan for. We just don't know how big of a cut to take, how many people that would ultimately impact, and what we would need to do to address that. And until we see specifics, we just don't know.
You'd almost be better off to get a number.
Yeah. I mean, we have a number, right? We have a $1 billion, or we have $880 billion. The $800 billion is in the House. The $1 billion is in the... And so we've heard different things of what they want to like look at. We just don't know if it's going to actually make it into the final bill and be signed into law. And that's over 10 years.
Okay. Wow. Okay. That's a lot of money. How involved is the Vermont legislature in this discussion?
They're very involved. And we talked to the congressional delegation on a kind of periodic basis to check in and have these conversations of what they're hearing, what we're hearing, and how this impacts us in Vermont. We have a monthly call. We have a standard monthly call with them in which we report what's going on in the Medicaid program, and they report back. And then we also have ad hoc conversations with them as well. And they are also very concerned about what could happen to the Medicaid program if these extraneous budget cuts come through.
And what about the Vermont legislature here in Montpelier? Are they involved in this discussion yet?
Yeah, so I just got done meeting with several state legislatures, and they too are very concerned about what is going on, and we just don't. There's just so much uncertainty. We just don't know where to focus right now of what's going to be the impact and where can we actually help.
So it sounds like there's a lot of wait and see.
It is, and it's a tough job to kind of just sit back and wait and see and hear and read the news or social media of what's going on, because things change all the time and sources change all the time, right? The direction of where we're going. Sometimes Medicaid is not going to be cut. Oh no, Medicaid is going to be one of those programs that has to be touched. So it's almost like watching a tennis match almost, right? Like looking at the different sources and saying who knows what and what information do we have to base our information off of and our decisions. And so it is really a wait and see until we have something to really kind of dive into and analyze.
Tell me a little bit more. I didn't quite get the tennis analogy.
Yeah, I mean, it's a lot of back and forth. Like all the information, right? Like it just changes. And then we've been working with the National Association of Medicaid Directors too, which is a national, and they have been working with their states and their state congressional delegations as well to help them understand what these changes mean for their states too. So it's not just Vermont working with Bernie and Peter, it's everyone is working together to kind of be like, this is a big deal. There's coverage, but there's also access to these services as well.
What's the difference?
I mean, I think what it is just more kind of education. Like I feel like sometimes when you're in Congress, you have multiple kind of topics. And so not everyone is well informed of, you think you're just going to have a budget number to cut and that's it. And that's simple, right? But there are actual lives attached to this, actual providers and businesses also attached to it. These things have an economic impact too, right? These things have a ripple effect, right? We talked earlier about the hospitals and how much they depend on Medicaid, right? Like if they lose that, they close. If they close, that also impacts like their employees, right? Where are they going to go for insurance if they're not eligible for Medicaid?
And it also, Becca Ballot makes the point, it not only affects people that are on Medicaid, it affects everybody, because if those hospitals close, those hospitals close.
Exactly.
You know, I spoke recently to the Attorney General here in Vermont, and she has been working with other Democratic attorneys general, forming coalitions, filing suits. What's your experience been in dealing with other states? Is there a blue-red divide here going on the way she has been experiencing?
I don't know if there is. I mean, when on these national calls with the Medicaid directors, everyone is concerned, right? And so it's about educating everyone about the uncertainties that we're facing and what could happen if these things happen.
How well informed do you think the public is on this?
You know, I don't know. I mean, Medicaid in general is very hard policy is very hard to understand, right? Like, especially the financing side of things. I think about my part when I have my construct conversations with my partner, like it's often a educational like he's been with me for 18 years, but even in that, and I've been dealing with Medicaid that long, it's still an education of what it actually means. And so I think there's a lot of public education that needs to happen about Medicaid. And I think there's also misinformation out there about the Medicaid program and how it's funded. I think you get words thrown around about fraud, waste, and abuse, and not having an actual definition of that taxonomy, right, is very difficult to have those conversations of what actually is fraud, waste, and abuse. And so thinking about those things and helping them be more educated about what the Medicaid program is and how it serves Vermonters in general.
Well, here's a golden opportunity. So knock down some of those myths for me.
I mean, what myths do you have? I mean, the things is Medicaid is a very cost-effective program, right? It's because of that federal-state partnership that Vermont has a balanced budget, and so there's always this kind of constraint around that budget piece that we are always looking at the cost of the program and what is best, what are we doing with that budget, and looking at whether it's going into eligibility populations, whether it's going to providers, whether that's going to covering more services, right? So it's those three things that make it a cost effective. And when you look at it from and the quality of care is very similar to what you get from a private insurance, so what you get from the Blue Cross Blue Shield plans or Cigna or United Healthcare. It's very similar. And so you're getting that same coverage. We're also doing it in a cost-effective way. And so all those things, and we're not really kicking people off the program either. We have very tight maintenance of effort, so of not being able to kick people off unless they're not eligible for the program. And so we come into compliance with that. And so we make sure that people are covered. We're doing outreach to the entire eligible population. We're not cherry picking who's in and who's out. Everyone who's in gets into the program.
One of the things I hear about the Medicaid program is that its reimbursement rate is barely enough for hospitals, providers. You know, you mentioned the federally qualified centers, places like Stowe and Morrisville, which are having difficulty, and that the Medicaid reimbursement as it stands today, even before these cuts, is too low.
Yeah, and I think that's hard to kind of address. Does it cover the entire cost of care? No, but we have emphasized. But do we kind of match what Medicare? We do some reference-based pricing, and we say how much does Medicare pay for these services, and then how much does Medicaid look at it, right? And so there's always this back and forth, and sometimes we pay more than Medicare. And sometimes we look at, with the hospitals, they're put on like a global budget. They have a prospective payment payment. So there are these things that we look at, and we try to one. We have to be good stewards of the budget, right? So we can't get as high as they want, but we are able to give them hopefully something that they are able to operate for.
Well, and one of the effects that people talk about is that if Medicaid or Medicare, for that matter, which has higher rates of reimbursement, if they don't have high enough rates, then it falls on the commercial insurance sector.
Yeah, I think you can make that argument that there is some cost shifting or payers of commercials have to pick up what the other two payers are, and that could be true in some aspects, but it's not true in it's a total shift to the payers. Medicaid also picks up some of that as well. So there is some shifting, but that's kind of like healthcare economics and how that works. Right,
which is you need a whole different degree. You know, one of the things you talked about earlier was misinformation out there. And, I remember there was discussion that the Trump administration said, we're not going to be cutting Social Security, Medicare, or Medicaid. But then in the next breath, Elon Musk, who's the head of the Department of Government Efficiency, talked about how Social Security is a Ponzi scheme. So is that the kind of comments that give you pause and make you concerned about what the future is here?
Yeah, it's that kind of dueling kind of information that's out there. One person says this, and the next person says this. So who are we supposed to be listening to, and what is that source of truth, right? And until we see something in legislation, we just don't know.
What should people be doing out there?
I think the same thing that we are doing in the Medicaid program is just watching what is going on and waiting. I don't think there's a need to be a cause of hysteria or panic, because we just don't know what's happening or how that is going to impact folks. And when we know, we're going to let the people know.
How do you let people know about these changes?
Yes, so it's talking to people like you and getting on and talking and sending out notices and information and working with our community partners to kind of help disseminate that information.
How soon do you think realistically you'll have a better idea about what's going to happen here?
If only I had a crystal ball, right? I don't know. All I know is that they have until the end of the fiscal year to make a decision. And so what we have heard is that they have started to work on that budget reconciliation language, but no one has seen what that actual language looks like, or if they have come to agreement with at least that framework of how much they're looking at cutting.
Wow. I don't envy your job.
Not a lot of people do. But I mean, I have the privilege of serving, and this is something that I'm very passionate about, and making sure that there's access to care, and it's a very personal thing for me to make sure that we continue this.
You mentioned you've been doing this for 18 years now. So tell me about that. Tell me about the evolution that you've seen over time here, and how this moment here compares to your prior experience.
Yeah, I mean, so when I first began, I got out of grad school in 2008, and so we started to look at, I joined a trade association, the National Association of Children's Hospitals, and one of the things there was looking at the Medicaid policy, especially for children. So the CHIP program was up for reauthorization. So going from that and making a proposal of universal children's coverage there to the actual Affordable Care Act being implemented and passed. And so it's kind of gone through this, let's make sure people have coverage, right? And then kind of also let's protect this coverage. And then we have the Biden administration, and it was like, we're good now. And now we're here with we need to protect it again. And so it's taking those kind of lessons learned and working in Washington, D.C., and taking what I know about the Medicaid program and coverage and economics, and thinking about how do we best do these things that serves the most people that we can, but also knowing that there's a lot of uncertainty going on.
Realistically, if these cuts go through, either proposal that you've talked about here sound pretty significant. So where do you think that's going to leave people? So what are they going to do?
What we're going to see, I mean, right? It all goes back to coverage. Like, where do they go for coverage? You're going to see, if we have to cut coverage or eligibility, there's going to be a lot of uninsured folks. If we have to cut provider services rates, that's a lot of providers who are no longer going to be able to take Medicaid, or no longer going to be in business because we've cut their funding and they're no longer financially viable. Or our Medicaid members are not going to be able to access services, right? If we cut services, could it be dental? Could it be some chiropractic? Could it be something else? Who knows what that service is? But they're no longer going to be able to access that service. So it's all about access to these things, and making sure, and what we need to do is make sure that we're protecting as many people as possible, and protecting the services that they ultimately need to best for their health. And so it's really a, who knows? I mean, the process that we're going through right now is taking an inventory of what is everything that we have in the Medicaid program, who is being served by it, and how much does it cost.
Do you see a scenario where you could keep basic services and remove other services that are, maybe rank lower on a scale?
Yeah, I mean, that goes back to that mandatory, what's a mandatory benefit, what's an optional benefit, and keeping those core mandatory services, and then saying, here are the things that we could actually cut that, one, may not be utilized as much, or kind of, here are the things that do not have high value, and look at it that way. I don't know what that looks like right now.
Because, you mentioned hospital service. Mm-hmm. I mean, that seems about as basic and mandatory as what you could have. Yeah,
hospital, primary care, mental and substance use. Those things are key to Vermonters' health. So what we'll need to do is to really take a look at what are those are kind of broad categories, right? But what are the individual services that are being served there, or that are underneath of that umbrella?
Because, when you talk about this, what I hear too is that you cut services and then people wind up in the emergency room.
Yeah, exactly. I mean, and it's that unmet need. They didn't have access to the basic needs. And then where do people go? The emergency room.
Which is the most expensive service that you could possibly have.
And so that's a pressure that we want to make sure that we're avoiding of having them end up in the emergency room.
But you're not hearing from recipients yet. Am I right about that?
I haven't started hearing from recipients, but I think that's because we just don't know, and we don't want to have people to freak out until we know more.
Are you sleeping at night these days?
You know, I mean, there are nights where this keeps me up, and I worry about it.
Anything else you want to mention?
Yeah, I mean, so a lot of the talk that we've talked about was the impact on Medicaid. What people aren't talking about is that the federal subsidies for the marketplace, the health exchange, Vermont Health Connect, are expiring. These advanced premium subsidies are expiring at the end of the year unless Congress acts. So that's about, in this year alone, we had 32,000 Vermonters, which is an historic open enrollment for Vermont, enroll in purchasing private insurance. And so if those subsidies go away, that goes back to the affordability of healthcare coverage, right? And you're looking at about $65 million of that funding just for Vermont alone. So that's more expensive for families and individuals, particularly those over the 400% of the federal poverty level. So that's a huge thing that no one's really talking about right now, but it's also very important as well.
But obviously, if they're going to cut Medicaid, those subsidies would seem like no chance.
Yeah, and we just I mean, again, it's just we don't know whether Congress. I mean, there's what we have seen in the part of this was the passage of the Inflation Reduction Act, right? That kept these these subsidies to cover premium, like in place. And with going away, that's a huge thing. Whether that's a congressional priority, we just don't know. And that also needs to be a part of that conversation. I feel like I'm doom and gloom here, and no bright and shiny, nothing to hold on to. But I mean, it's just uncertain, and we're here to make sure that we are protecting the services and the members as best we can.
What do you think is the most likely outcome here?
You know, Congress always surprises me. So they could do something where we get something small, work requirements maybe, or I don't know. But I don't know. I mean, that's the hard part is you just don't know, and you just hope that it's not the worst case scenario that you're planning for.
You know, I don't want to be an alarmist here, but let me just run this scenario by you. It seems as though if the cuts as proposed are made, we could have hospitals closing or add to the pressure to close hospitals. We could have nursing homes that can't make it either. We could have people that have no coverage at all. I mean, am I being an alarmist by saying that?
No, you're not being. I mean, I would say that you're actually being a realist here. These are all things that are possible. We just don't know what is going to happen and how big of this impact is going to affect putting businesses out because we're no longer there's not an ability to pay them.
What's the best case scenario here?
I think that the best case scenario is we get the Senate gets their way and looking at a $1 billion cut. Is it ideal? No, but at least it's not as bad as $180 billion. What we have heard from the Senate side of things is that they only want to touch a few things. They only want to tinker around with provider taxes or looking at some rules that came out from the Biden administration, maybe work requirements, but also kind of going back to like there was this nursing home a minimum staffing requirement, and going back and kind of repealing that. So that's ideal. If they just want to tinker around the edges of the Medicaid program, that would be great. Ultimately, I would prefer them not to touch it, but It is what I mean. So ideally, it's the Senate winning this kind of battle between 1 versus 180 billion.
I know there's different proposals in different chambers of the United States government, but the difference between $1 billion and $180 billion sounds really large to me.
Oh yeah, it's a huge difference. It's like basically taking a scalpel versus taking a sledgehammer to the Medicaid program.
That wraps it up for this edition of 802 News, sponsored by Red Hemp Banking Company. Thanks for listening.